Do you enjoy working out? Have you experienced pain and tightness in the following days? Then you have experienced the phenomenon known as DOMS. What is DOMS? DOMS stands for Delayed Onset Muscle Soreness, and it is the pain and soreness experienced in the muscles after hard exercise that usually occurs between 24 and 72 hours after the exercise is finished. It is said that DOMS is normally increased from eccentric exercise. Eccentric exercise occurs when a muscle lengthens while it's still generating tension. Some examples of eccentric contraction include the down motion of a curl, the downward motion of squatting, or the downward motion of a push-up. DOMS can be a problem because it leads to tight and achy muscles that can inhibit training intensity in the following days or decrease one's ability to perform at their highest level. So why does DOMS occur? In the past, it was generally thought that the buildup of lactic acid in the muscles is what caused the pain and soreness. However, this has been disproven for a while now because lactic acid flushes out of the muscles within 1 hour after exercise. The best explanation for what causes DOMS cannot be explained by one mere causal factor. Instead, it is thought to occur via 4 different factors, or theories, that all work together to produce DOMS. These 4 theories include the connective tissue damage theory, the muscle damage theory, the inflammation theory, and the enzyme efflux theory.
First is the connective tissue damage theory. This theory looks at the role of the connective tissue, more specifically collagen, that forms the thick sheet of fibrous tissue around bundles of muscle fibers, and how it becomes broken down from exercise. 2 of the main amino acids found in collagen are hydroxyproline and hydroxylysine. Support for this theory comes by measuring the levels of these 2 amino acids in the urine after exercise. After heavy eccentric exercise, the connective tissues around the muscle fibers gets broken down, and contents of collagen like hydroxyproline and hydroxylysine get excreted into the urine in higher amounts than normal in the following days. This indicates the breakdown of the connective tissue around muscle. Second is the muscle damage theory, which comes from a disruption of the sarcomere, the contractile unit of muscle, at the Z-line. It is caused by an increase in tension over the area of the muscle fibers that damages the muscle cells and reduces the muscle's ability to fully contract. This causes pain receptors at the level of the muscle fibers to become activated, and any movement of the muscles causes more pain due to the increase in pressure on the sensitive nerve endings. Third is the inflammation theory, which comes as a result of damaging both the muscle and the connective tissue. The breakdown of these tissues causes an influx in inflammatory molecules such as monocytes and neutrophils to the site of damage. Once monocytes reach the damaged tissues, they convert into macrophages that end up producing chemicals that sensitize nerve endings in the muscles, leading to even more soreness. The muscle tissue damage also causes an influx of fluid into the muscles, which can result in swollen muscles or edema at the peak of soreness. Last is the enzyme efflux theory, which states that as a result of damage to the muscle cells, calcium, which is normally stored in the cell, is released and reduces the mitochondria's ability to generate ATP. This disruption of calcium homeostasis and the subsequent decreased ATP regeneration from the mitochondria may play a role in the sensation or loss of muscle strength and endurance that is associated with DOMS. All of these events lead to the sensation of DOMS.
Almost anyone who experiences DOMS looks to any method around to try and alleviate the symptoms, some of which may include ice or cryotherapy, stretching, massage, anti-inflammatory drugs, electrical current techniques, compression, and exercise. Icing may provide some pain relief effects, but both ice and cryotherapy have shown no effect in reducing DOMS. While stretching before and after exercise is beneficial to prevent injury, it has no effect on reducing DOMS.
Some anti-inflammatory drugs have been shown to reduce the perceived pain attributed to DOMS. Electrical current techniques such as TENS units have promising results due to the increase in blood flow to the muscles and the release of endorphins, but this is also inconclusive. Massage and compression techniques may be beneficial, but more research will need to be done to determine whether or not they are effective. Exercise is one of the most effective strategies for reducing DOMS because it increases blood flow and releases endorphins. However, these effects subside after exercise is stopped. There is still a lot to be understood about DOMS and how to alleviate it, but one thing is for certain: no pain, no gain.